Do you lose muscle mass on Ozempic and Mounjaro and some of these other weight loss medications? I'm Dr. Allo. I'm a board-certified cardiologist. I've been practicing obesity medicine for somewhere in the neighborhood of about 20 years, long before we had these injectable medications, back when we used to just use pills, which we still use today. So the biggest question is, do these new weight loss medications cause you to lose muscle mass? Because there's been a lot of health influencers out there, and you've seen like the Jillian Michaels. I did a whole podcast on that. Search Dr. Allo Show on your favorite podcast player and look for Jillian Michaels episode on the Bill Maher Show. There's even been doctors out there saying that don't use these new GLP-1 medications, don't use Ozempic, don't use Mounjaro because you're going to lose muscle mass. So the question is this true? Now, if you've been watching my stuff for a while, you kind of know my stance on this because you already know what I'm going to say. I published a book called Actual Weight Loss, where we looked at how to lose weight correctly, regardless of how you want to lose the weight, and we looked at how to preserve muscle mass while on a diet. Now, we've known in the past that anytime you try to lose weight, whether it's diet or exercise or anything in the past, when you lose weight, you will lose some lean body mass. They sometimes call it fat-free mass. They sometimes call it lean body mass, etc. The problem is we want to lose just fat. You want to use fat mass, not fat-free mass. Fat-free mass could also include your organs and your skeletal muscle and muscle glycogen and water and food in your stomach. So we would like to be able to distinguish between fat-free mass and skeletal muscle loss. Those are two very distinctive things. And if there is a way to do that, that would be fantastic, because we could look at, well, maybe we are preserving muscle mass while losing fat-free mass from other areas, like your organs get a little smaller. There's not as much food in your stomach, not as much glycogen, stored wherever. So that is a question that was answered recently by a study by Kevin Hall and Associates. But I'll give you some background data first before we get into that study to kind of get some background information. Now, for the longest time, gastric bypass causes the most weight loss the most quickly. When you lose weight quickly, you're more likely to lose muscle mass, especially if you're not getting enough protein and or if you are not lifting weights. So we've known that for a very long time. And gastric bypass causes rapid weight loss, which makes the muscle loss more accentuated. So let's say, you lose 100 pounds in that first year after gastric bypass. Anywhere from the neighborhood of about 20 to 30% of that 100 pounds, so like 20 to 30 pounds, will probably be fat-free mass or lean body mass. That can come from many different things, which we'll get into. If you lose weight slowly, there's less muscle loss lost. Let's put it that way. So of that 100 pounds, if you didn't do gastric bypass and you dieted and exercised, moderate calorie deficit, not severe, you lost weight over the next year, of that 100 pounds that you lost, maybe only 10 to 15% of that, 10 to 15 pounds, maybe up to 20, might be lean body mass instead of up to 30. So that's the whole point. And if you've read my stuff or watched some of my other videos on here, the key is you want to lose weight, you want to lose fat without losing muscle or lean body mass. And the way to do that is to lift weights while you're doing it. And I have an exercise program. You can click on my links to get it. It's totally free, that I use with all my patients, my clients, everybody. And then you want to make sure you get enough protein. We usually say you want about 1 gram per pound of lean body mass. So if you're a 200-pound male and you think about 140, maybe 150 of those pounds are lean body mass or what you want to weigh, then you need to be getting 140 to 160 grams of protein a day. If you're a female, it's slightly less, about 120, maybe 140 grams per day. Or another way to look at it is say, what do I want to weigh? Let's say I'm 300 pounds, I want to weigh 180. Then it's 180 grams of protein per day. Now, the more overweight you are, the more likely you are to lose mostly fat initially. So if you're like 400 pounds, the first 100 pounds you lose is probably mostly going to be fat. You will have some that isn't. The leaner and leaner you get, or the closer to your ideal body weight that you get, or your goal weight that you get to, the more likely you are to start losing some muscle mass or some lean body mass. And that's just normal. That's with or without medications. That's just diet and exercise. Everything we've known about exercise science, weight loss for years, for centuries even maybe. So that's not the question. The question becomes, do these medications cause more lean body mass loss than traditional methods of diet and exercise? So if we put people on the same amount, same rate of weight loss, same calorie deficit, same exercise protocol, same everything. Everything is equal. The calorie deficit was created with the medication in one group, and the calorie deficit was created with a not eating it. In another group, isocaloric protein, same amount of protein for each person. Do you lose more lean body mass in the Mounjaro or Ozempic group versus do you lose more lean body mass in the regular diet and exercise group? And this is what Kevin Hall and colleagues did. I'll put up the first chart up here, or maybe up here is more space. They looked at people's body composition at the beginning of the study, and I'll maybe circle that or point to it. They looked at percent of lean body mass or fat-free mass, fat mass, and skeletal muscle. They wanted to distinguish skeletal muscle because they're saying, well, maybe it's true people lose a little bit of lean body mass, but if it's not clinically relevant and they're able to do more, does it really matter? I've had patients that used to come in on a motorized wheelchair, could barely get out of bed, could barely get up to use the bathroom. They lose 80 pounds. Now they're actually walking into clinic. No more wheelchair. No more somebody has to push them in. No more can't get in and out of the car. I had one patient, very dear patient, lose 80 pounds in 2 months. And I talk about this a lot on some of the other podcasts. Search Dr. Allo's show for my podcast. But when you lose 80 pounds in 2 months, and it wasn't just Mounjaro or Ozempic, it was a combination of 3 different things. I teach an obesity medicine course. You're welcome to grab it on my link section. Grab my obesity medicine course if you want to know how to do that. But when you lose 80 pounds in a short period of time, in certain cases, a lot of it is water weight, because if you have CHF and kidney disease and all kinds of other stuff, a lot of it will be water weight. But a lot of it was fat mass. And losing 80 pounds makes you very functional. Now you can get up and walk. So how do you rectify that? Because on one hand, we're saying people are losing weight, but getting better and able to do more, but they're losing lean body mass. So is it clinically relevant? Does it matter? Let's say he loses 20 pounds of muscle, but he lost 80 pounds total, but now he's able to walk and play golf and play soccer with the kids, throw a football around, instead of sitting in a wheelchair all day and using his motorized wheelchair to go to Walmart or wherever to pick up food and what have you. So is it clinically relevant and does it really matter? So that's exactly what this study did. So they looked at skeletal muscle, they looked at other fat-free mass, other lean body mass, non-skeletal muscle. This would be like your bones, organs, tissues, etc., food in your gut, etc. And then they looked at fat mass. And they looked at how much of this changes when you put people on diet, and exercise, or you use these medications. And is it not just clinically relevant, but does it even matter? They also looked at what happens when you diet, but you get enough protein. The key here is you want to get people on a calorie deficit plus the same amount of protein, plus then throw in the other variable of throwing on medication. So you want to change one single variable and see how it affects it. So they found that in general, the group that had exercise did not lose as much skeletal mass. And I'll put the chart up here, the first chart. They all of them lost weight, obviously, similarly, but did their body composition change? The skeletal muscles on the bottom, the fat-free mass is right on top of it, and then the fat mass is right on top. You'll notice from the chart that their body composition overall did not really change. The exercise group had a very slight uptick in skeletal muscle, probably negligible, but it did go up. So whether they did diet only, diet and protein, and diet and exercise, the body composition before and after weight loss stayed the same, and skeletal muscle stayed the same. That's one thing I want to show you. In fact, in the exercise group, it maybe ticked up just slightly. So skeletal muscle mass stayed the same, which is very, very crucial. But their fat-free mass and their fat mass also, percentage-wise, stayed about the same, right? So that's important to know. Here's the trick. Here's the interesting thing. When they looked at what the medications did, in fact, you notice that maybe their lean body mass or their muscle mass actually went up as a percentage of their total body weight. And I'll put that chart up here in a second. But they looked at retiroprazide, Ozempic or semaglutide, or semaglutide, people pronounce it differently, and Mounjaro, tirzepatide. And they looked at how much weight they lost and how much of it was skeletal versus fat-free, whatever, same thing they did with the other one. Most people lost about 10 to 15% of total body weight. The Mounjaro group lost the most, and you'll see that obviously here. Lost probably the most amount of fat-free mass, The next group was Ozempic. And then the least as a percentage of total was actually the Mounjaro group. So the group that lost the most amount of total weight lost the least amount of total fat-free mass. So you could argue that because most of the fat loss in that group, and even the other two, most of the fat loss came from fat loss, actual fat loss, not lean body mass, not fat-free mass, that their lean body mass went up as a percentage. Let's say you weigh 100 pounds, 60 of those pounds are, lean body mass, 40 is fat. You lose 20 pounds, and 15 of it comes from fat, and only 5 of it comes from lean body mass. Now you have 55 pounds of lean body mass. The other 15 of the 40 is down, so that's like, another 25 left. Now that your body composition is way less fat and just a tiny bit less muscle, your lean body mass, your muscle mass, quote unquote, went up compared to where you started before, because you lost mostly fat and just a little bit of lean body mass. So this is kind of to dispel these rumors, because you got Jillian Michaels out there. You've got all these people out there saying, oh my God, I did a DEXA scan and people lost muscle. Well, yes and no. No matter how you lose weight, you're going to lose some muscle. There are ways to mitigate that. Read my actual weight loss book if you want to know. But definitely, if you eat more protein, lift weights, you will mitigate that. Less of a severe calorie deficit also mitigates that. And at the end of the day, these medications seem to maybe even increase as a percentage your lean body mass versus fat mass. So at the end of the day, these medications are not doing any more specific harm. And if patients are still functional or more functional, like my patient that now can get out of a wheelchair and walk around and do things, if patients are more functional, is this clinically relevant? Let's say you do lose 20% of your body weight from lean body mass or skeletal muscle, which has now been shown that it's not actually skeletal muscle, it's just other organ stuff. Your skeletal muscle stayed about the same, but you are losing, fat-free mass from other areas, but it's not clinically relevant because you can do more, you can walk further, you can play sports now, you can run around, maybe shoot a basketball, whatever. Does it really even matter? I say it's a win-win. If you want my opinion, I've been doing this for a really long time. Byetta and these other GLPs have been around since 2003, 2004, maybe 5, I think. And we've been using these for a long time. We know what they do. People do lose weight. They could lose a lot of weight. If you combine them with other medications, they could lose even more weight. A lot of these medications are like, well, most people in this study on Ozempic only lost 15% body weight, whereas Mounjaro was like 22 or 20. But if you combine them with like some of the pills, some of these other medications that we use, grab my obesity medicine course if you want, people are dropping like 25 to 30% body mass, some quickly, some a little slower, some over a year or so, but they're super functional and you've given them their life back. These medications have made it so easy for people to stick to a calorie deficit, get motivated to go to the gym, get up and walk, and do things with their kids. All the stuff that we tell people to do, these medications have made it more possible, and they have been life-changing. If you like stuff like this, follow me, join my community. I have a private community where we talk about this stuff privately on Zoom every Monday. There is actually a video on here that was one of our live Zooms recorded and posted, but definitely follow me for more information on stuff like this.